I'm Jennifer Garrison Dean, the Suicide Prevention Coordinator at the local VA. I'm also, I think, the panelist with the longest name. So thank you. It's really good to be here. The VA first established the suicide prevention program on a national basis in early 2007, and we've got a lot going on at the VA. I want to highlight a few of the components of our program that I'm most excited about and that I hope are going to be most pertinent to you. The things I want to talk with you briefly about is our role and involvement with the National Suicide Hotline. Also, I want to tell you about our recent enhancement of expedited mental health services. And I want to tell you about our educational component, our community outreach and education component. In fact, I'm going to start there. We've heard so much about the importance of recognizing warning signs. In fact, our central mantra is that suicide prevention is everybody's business. And what is everybody's job in terms of intervening in suicide prevention? It's first and foremost understanding and recognizing, getting ourselves familiar with the warning signs. This pamphlet is great for that. Also the pamphlet that Christina handed out. It's got a listing of the warning signs. This one also has local resources. All of our materials have the National Suicide Hotline, which Christina mentioned earlier, and I'll further develop insofar as its use for vets. And it also has in neon our local information for the local VA. It's a neon green because in suicide prevention here locally we're not any wallflower. We want to be known. We want you to see us and reach out and get some information and contact us if you have concerns. The program we're using to tell people what to do once they've recognized the warning signs has rolled out this year is VA ACE. And what that ultimately stands for is ask the questions, ask the very difficult questions for us all to talk about. Ask, are you thinking about killing yourself? Are you thinking about taking your own life? The next piece is care for the veteran, care for any individual in your life. Don't leave them. Don't leave them if they're suicidal. Stay with them. But they won't go to the ER with you. They won't come to the VA with you. They're resistant. They're scared. They're unable to respond. Then call the National Suicide Hotline. We've all got cell phones. They will walk you through what to do. They will conduct a rescue on your behalf if that's necessary. But they will give you the answers when you don't have them, but you know that you're with someone who has a problem with suicidal thoughts. So stay with that person. Care for the vet. Care for that loved one. And thirdly, the E is for escort. Escort the individual to safety. Bring them to the ER. Bring them to the VA. Bring them to their mental health provider. And if you can't, call the hotline. They will, and have in many, many cases, do the rest for you. But step forward, a really big component about ACE and why I think it's so important that we all be educated about what to do. Noticing the warning signs for most of us is not the really tricky part. But imagine the difference between recognizing the warning signs, although the individual hasn't said anything about take life, hasn't said anything about suicide, but their story is no doubt one of hopelessness and helplessness. You've already said, well, can you do this? Have you tried this? Have you talked to that person? Have you applied for this? No, I've tried it all. The VA won't help. My wife left me. She was tired of the drinking. It's a story of hopelessness, and there's no way out. You know that there's a serious, serious problem here. There's a lot of distress here. There's an enormous difference once you know that something's going on. Imagine the conversation that goes, well, wow, Barbara, I see that, you know, it sounds like you're having a real rough patch. I am so sorry to hear that. I can tell you're in a lot of distress. You know, no doubt things will get better. Listen, you take care of yourself, you hear? Okay, imagine that conversation, more common one we have, as opposed to taking the risk, stepping out, taking the chance and saying, you know, you've got too much on your plate and these losses, and there's nobody there for you. That's overwhelming me almost to hear about it. I know when other people have been in the same shoes that they've actually considered taking their own lives. Is that where you are? Is that something that's going on with you? Find your way, find your style to ask the questions. But ask the direct question. It doesn't do the same thing. It doesn't get you to the same place. Doesn't enable an intervention if you say, wow, you're not doing too good, are you? Huh? That's not the same as saying, are you having thoughts of suicide? Are you considering ending your life here? An enormous difference. And when somebody tells me, yeah, actually I am, and when you're competent and confident and caring, and you're going to take the time to listen and be there, when they know you can handle the genuine answer, no matter what the response is, you can handle it. So when they tell me, the first thing I usually say is, I'm so glad that you shared that with me. I'm so glad that you trusted me with that information. And you know what? I know exactly how to get you help, and we're going to get you help right now. And then I go on about getting them to the ER, bringing them back to my office, because we also provide direct services at the VA. So once we've identified that someone is having a problem related, any problem related to suicide, if you're having thoughts, we want people to start recognizing that and treating that as akin to a heart attack symptom. That's something that we need to be very, very responsive to. So when that happens, we can, we've established a new system as an extension of our mental health clinic. Over the past year, we call the SOS clinic. In this case, SOS means a lot of different things in different contexts. This means short-term outpatient stabilization clinic. So we still have our routine bureaucratic way of doing a lot of business. You call in, you're not in particular distress, you're transferring care. Okay, it's going to take you about 3 weeks to get you an appointment. We'll do that. But if you're in significant distress and you can come on site, and you don't want to go through the ER for whatever reason. Sometimes it's recommended not to go through the ER if you've got an inside source, if you're an established patient there, if you're on site at the time and you're in distress, you're out of medications, you're troubled by your symptoms, any of these things, building up to suicidal, then we are going to, at our outpatient, you present to the outpatient clinic, tell them that you need to be seen today or you need to be seen by someone soon, and we've got an arrangement to facilitate same day to same week mental health care, whether it's to see a social worker, psychologist, psychiatrist for med management, whether you need to be screened for appropriateness for inpatient treatment, for your safety and stabilization. So we've rolled that out this last year, and I'm thrilled that we've got that kind of expedited access to mental health services. We also are very involved with the National Suicide Hotline. Christina oriented you to it. Basically, if you're a veteran, however, and all of our materials will say press 1 for vet. That's the only automated. Otherwise, you're talking to a master's level trained clinician. Vets are immediately hooked into clinicians, many of whom are veterans themselves, so they get it and they dig it and they are committed, and they answer the call, and they provide the whole range of services between crisis intervention, dispatching a vehicle to your location immediately to bring you to safety, to maybe you called because you don't know how to get care at the VA. You've called a couple times and gotten transferred around and the call dropped and it's a big bureaucracy. How do I get in with mental health services? No matter why you call, whether it's emergent or not, and we get a lot of non-emergent calls, they are going to refer you to me as the local provider if you're a vet in our catchment area. And I've got 24 hours to conduct outreach, reach out to you, prioritize and expedite mental health services access for you. So it's a great system. So you think you're a vet in our catchment area and you call this anonymous hotline number, and ultimately it patches you back through to a local referral. It's a fantastic system, and in fact, veterans from World War II to the current engagement are using the line tremendously, and they actually, as of July, had 10,000 active rescues. Now, there have been hundreds and hundreds of thousands of calls for this reason and that. 10,000 active rescues means the veteran is on the phone with the hotline responder with the gun in the hand, with the pills, or already having taken the pills, with the method and means and intent right there, but is making one last cry for help. And they've swooped in and saved these lives. It's a fabulous, fabulous resource. So I'm just thrilled about what the VA is doing and to be a part of the VA, and I will welcome any questions or comments or ideas for additional services that you have for us. Thank you so much.